And we are live on Facebook and YouTube.
All right, I'd like to welcome everybody to the Carroll County Commissioners Meeting, Monday, September 8th. Please join me for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Commissioner Workner.
Here.
Commissioner Madransky.
Here.
Commissioner Leggett.
Here. Certification by the clerk.
I, Melissa N. Sharp, clerk, certify that the entire recording of the proceedings of the prior meetings are captured completely and accurately in the electronic record and are available at the office.
Motion to approve the summary recording of the minutes.
So moved. I'll second.
All in favor, aye.
Aye. Aye.
Motion to approve appropriations.
Move to approve. Second.
All in favor, aye.
Aye. Aye.
Aye, motion is carried. Bills today are $395,687.31. Motion to pay the bills.
Move. I'll second.
Any questions on the bills? All in favor, aye.
Aye.
Aye, motion's carried. Motion to pay the bills without prior.
Move to pay. Second.
All in favor, aye.
Aye. Aye.
Aye, that motion's carried. I'd like to advise Merle Long, Assistant Dog Warden, filed his report for the week of August 31st, 2025 to September 6th, 2025, showing 5 dogs impounded, 0 adopted out, 2 redeemed, 0 euthanized, 0 citation for no license, 0 citation for running at large. I'd like to advise the prosecuting attorney filed his report for August 2025 for the Carroll County Child Support Enforcement Agency. There was a total of 1,026 open cases, active cases. A copy is on file in the Commissioner's office. I'd like to advise Melissa Shar, Title VI Coordinator, advised that she has filed her annual report for the period of September 1st, 2024 to October 31st, 2025, showing no investigation lawsuit were completed against Transit or Basic Grace, Keller, or National. August
31st.
August 31st. Good job, Melissa.
Thanks.
Got a motion to reappoint Commissioner Christopher Madransky to the Eastern High Development Alliance Board for the 2-year term of January 1st, 2026 through December 31st, 2027.
I'll make the motion for that appointment.
I'll second it. All in favor, aye.
Aye.
Aye, that motion's carried. Motion to approve resolution 2025-23 designating banks as depositories for the active monies of Carroll County to enter into agreement with each institution listed for the prior retroactive August 23rd, 2025 through August 22nd, 2029. Motion for roll call.
So moved. Second.
Roll call, please.
Commissioner Workner.
Yes.
Commissioner Madransky.
Yes.
Commissioner Leggett.
Yes. Motion's been carried.
What was the number on that resolution?
2025-23.
Thank you.
So at this time, we have a proclamation for Suicide Prevention Awareness Month. Got people coming in. I was gonna say, it looks like we're kind of short on the names here.
Hi.
Morning.
Angie, did you bring a read copy or?
I thought.
Okay, we can give you one of ours then for.
So we're gonna start down here to the left and have you introduce yourselves.
My name is Leslie Corns. I'm the manager of community services at the Adams Board.
I'm Carly Thompson. I'm the drug court coordinator for the Carroll County Court of Common Pleas.
I'm Wesley Warner, clinical director for Southeast Healthcare.
Lisa Winkler, community prevention coordinator at the health department.
Kelly Morris, health commissioner at the health department.
Angela Pavlik, community engagement coordinator for the health.
Edward Hale, lead township advocate.
All right, so you're gonna read the proclamation?
Read it.
Okay.
We'd like for you guys to read the proclamation.
Proclamation recognizes September as Suicide Prevention Awareness Month in Carroll County. Whereas the month of September is recognized as Suicide Prevention Awareness Month, a time to raise awareness, reducing stigma, and promoting open conversation about mental health and suicide. And whereas we recognize those who are struggling with suicide thoughts, remember those who have lost, and supported the families, friends, and loved ones who carry a burden of grief. And whereas in 2025, suicide was the 11th leading cause of death in the United States, claiming over 49,000 lives, with more than 1.5 million suicide attempts reported. And whereas the Ohio alone, more than 1,700 individuals died by suicide in 2023, with suicides remaining the second leading cause of death for young ages 10 through 14, young adults aging 20 to 34. And whereas in 2024, Carroll County lost 9 residents to suicide, resulting in the suicide rates of 33.66 per 100,000, more than double the state rate of 14.6 per 100,000, highlighting as a significant public health concern. And whereas of year to date, 2025, the county has already lost 8 residents to suicide, underscoring and the continuing urgency of addressing mental health in our community. And whereas Carroll County Emergency Service responds to 148 911 calls related to mental health crises, suicide concerns, wellness checks in 2024, reflecting growth, community need, integrated crisis intervention and support. And whereas suicide prevention requires coordinated efforts among government agency, healthcare providers, school, faith, community, local organization, as long with a community to reducing stigma so that the individual feels safe seeking help. Now we, the Carroll County Board of Commissioners, do hereby proclaim September as Suicide Prevention Awareness Month in Carroll County and call on all residents to learn the warning signs, checking in on one another, and fostering a community of connections, mental health, and hope. Be it for resolved that to recognize the agencies and individual working to prevent suicide and support mental health, including the Carroll County Alcohol, Drug, Addiction, and Mental Health Service, Board Southeast Healthcare, and Spring Valley Healthcare, local behavior health providers, the Carroll County Suicide Prevention Community, and the Carroll County Suicide Fatal Review Board, whose work is vital to saving lives and helping families heal. At this time, I'd like to make a motion to adopt the proclamation proclaiming September as Suicide Prevention Awareness Month in Carroll County.
Move to approve the proclamation.
Second.
Any other comments or discussion? All in favor, aye?
Aye.
Aye, that motion's carried.
Mr. Leggett, I have the floor to proceed further on.
You may.
As I stated before, I'm an advocate. You know, I'm an advocate for many things. However, suicide awareness and suicide prevention, I believe, is the top priority to be an advocate for and to concern about. And I brought to you today a presentation board with different media headlines to show you how much this has all evolved. I wish to share these with you. These are media, you can look them up. They're not hiding, you just have to research them. Sometimes they're hidden in the papers because people don't want to see it, people don't want to acknowledge it, but it needs to be acknowledged. Morning Journal, Columbiana County, elderly suicide, the rise of a quiet crisis in Ohio. At 74, Jerry was a delighted husband, father, grandfather who always patronized his family needs. As he faced mental and physical health challenges, he began to feel like a burden. Believing that his family would be better off without him, he lost his battle with depression and died by suicide. That was a recent article in the Morning Journal in Columbiana County. Former Euclid, Ohio police officer dies by suicide in department's lobby. Police officer dies by suicide under suffering complications from LASIK eye surgery, parents say. That was WPXI Channel 11 out of Pittsburgh, CNN newsroom. That was recently an article, May 23rd, 2025. And sad incidents of police suicide, more officers commit suicide each year than are likely by felons. We need to fix the problem and save our officers. This was by a police chief October 31st in 2013, 12 years ago. Brayton police officer takes his own life. The department urges mental health awareness. July 25th, 2025, Fox 13 News from Florida. Veteran suicides on the rise in Butler County, August 7th, 2025. Napoleon police officer dies from what appears to be a self-inflicted wound. November 18th, 2024. U.S. Navy veteran kills himself in front of Audie Murphy Memorial Veterans Hospital to send a message, friends say. Mark Miller, 54, and his father co-authored a book in 2021 titled Suicide Stalks the Sniper. That was in an article on April 11th, 2025. Suicide is the top 5 leading causes of death in Ohio. And recently online, but not in the paper version yet, suicide deaths rise in Carroll County despite slight statewide decline, September 5th, 2025. As you can see, suicide affects everyone. Everyone from your first responders to your veterans, to your elderly, to even juveniles. Slight decline in Ohio. But as we read here and as we read here, Carroll County is still bringing in the suicide numbers. The rise of a quiet crisis in Ohio, deaths by suicide among older Ohioans. We need to be out there, we need to listen, we need to talk. And if you would honor me the moment, I would like to read a letter to you. I refer to it as a 1-minute speech, and the paper refers to it as a letter to the editor. It's something that needs to be read and something to be shared to the people who's fallen on Medium. In 1991, I lost a school friend. That was my sophomore year in high school. In 2005, I lost another school friend. And in 2023, an acquaintance who was a military veteran passed away. All 3 of these have one common denominator. All 3 of these lost their lives to suicide. Each September is recognized as Suicide Prevention Month as a time to raise awareness, spread hope, spark meaningful action around one of the most urgent mental health issues in our time. It's a time to focus on listening, reaching out, building a culture of care. Help is available. Help is real. And as no one must face the challenges alone. As a community, we must remind one another that no one is alone and help break down the stigma surrounding seeking help. We need to build the bridge and connect as a community. Start a conversation. Be the difference with just one conversation, asking someone, asking someone how they're really doing and being truly ready to be listened can save a life. No one has to face this alone. Help exists. Healing is possible, and all it can take is for one person to start a conversation. Talking about suicide isn't harmful. Silence is. Silence can cost lives, while conversations can save them. One life lost is one life too many. If you have ever seen the movie or television show MASH, you may know that the intro theme song is titled "Suicide is Painless." In that song, it states, "Suicide is painless, it brings on many changes." The first line is false. Suicide is painless for friends, families, coworkers, because their loved ones are gone. The second line is true. It brings on many changes because that person is no longer there, and ask questions of why, and was there something that could have been done, or something I could have been done to save my family, my family member, my friend, or my coworker. Suicide does not discriminate by age, profession, race, religion, or political affiliation. It's a time to focus on listening. If you or someone knows is in a crisis, you can call or text 988 to reach the Suicide Crisis Lifeline, or chat live at 988liveline.org. You can also visit speakingofsuicide.com/resources. Speakingofsuicide.com/resources for additional support. I appreciate your time this morning. I yield back.
Thanks, Ed.
Kelly, I have the health department copy here.
Okay. I would just like to address the board as well, just with some statistics related to what we are doing in the community. We have started a suicide fatality review board, which the Board of Commissioners had to allow us to start. We're in our second year of that. What we are finding with that, obviously, you heard that there was a significant increase, double what the state rate is for Carroll County. And what we're finding is that 85% of those are occurring to men over the age of 50, and that 95% of those are happening by gunshot wound. We've also started a suicide prevention coalition, which the Adams Board and Leslie are leading in the community, that is working on different strategies to reduce the stigma, as Mr. Hale noted. Working with a program called Man Therapy to help men understand that everyone has mental health challenges and that it's okay to seek help. And then we also are working with our faith-based community on Hope Sunday, which is, what's the date of that one?
28th.
Yeah, so it is really where many participating churches throughout Carroll County make part of their sermon to be about hope and suicide prevention and services that are available. We have some of our providers here today that are working with mental health in the community. So normalizing the conversation is the first step. And one of the strategies I think that we are looking at is a program called QPR. We like to think of it in the mental health world as CPR for everyone, but it's question, persuade, and respond. And that really is to start that conversation. If you see someone that is not looking well to you, that it's okay to ask them if they're okay and if there's anything that you can do. And it's not, there's a training for it because it's not an easy conversation for us to have, but it is one that if we start to teach our young people that it's okay to start talking about this, then we can save lives by letting people know that there is hope. And, you know, we're also looking at some gun safety measures because of the firearms being involved in just a split second. A lot of these are impulse decisions. If we can do something that delays that impulse decision just by a few seconds, then we could save lives as well. The other thing that we would like to figure out a way to implement is how can we work with the elderly population that has been newly diagnosed with a life-changing diagnosis. And that doesn't mean it has to be life-ending, like cancer, but could be life-changing from the fact of they're newly diagnosed with dementia. Many of the older individuals do not want to be a burden to their families. And when they get that diagnosis, many of the cases that we reviewed, their solution was to take their life by suicide rather than to be a burden to their family. So we're trying to figure out how can we work with the healthcare, and the physicians as they're giving those diagnoses to let them know that, let's have the family make a safety plan. Just because if there are firearms in the homes, which we know many of us have in our homes, in a rural community where hunting is part of our pastime. So, thank you, and I don't know if anyone else has anything that they would like to add.
Thanks, Billy.
Picture.
One thing that I would like to add is, I haven't heard mentioned say 22, which is another resource, especially designed for our veterans, but they will help anybody that is in need.
Yes, they're part of our coalition and our fatality review team as well.
I invited Mr. Endorf today, but apparently he couldn't make it.
Okay, are we ready for the picture? Sorry, you guys know the routine.
Almost, there's another one. I'll send it to him. Yeah.
You can come. That was just.
I
was seeing if it was fitting here. Yeah, here we go. Go ahead.
Thank you.
Thanks, lady. Thanks, Ed.
Have a good afternoon.
Yep.
Thank you for the work that you ladies are doing.
Yeah.
Thank you.
Well, thank you.
I'll leave it.
Back here, regularly. Thank you. Out there with it.
Pack of these, if you like to put them out there for the public that may come in.
Before I leave, I just wanted to thank the commissioners for the roof and the porch. It looks amazing.
Yes, it does.
Yeah, so thank you very much. We do appreciate that and know that it will help with the longevity of the building. So thank you very much.
I think this sign that we're gonna put at the annex building is also gonna have the health department on it with it
Oh.
down the road.
Nice.
I hope.
Yeah, thank you.
The proximity is close enough that it makes sense. And then the other thing I would share is not only was the work to the building functional in nature, it really improved the looks of
Yeah, it
it,
did.
much more attractive.
Yeah. Yeah, the porch, we call it kind of the Zen zone because we weren't anticipating that the metal railing was gonna be replaced. And when they made that, it really did look like a porch. The staff are saying, well, can we put rocking chairs up there?
If you got one more 30 seconds.
Yeah.
Can you tell us how the pop-up food pantry is
Oh,
going and
yeah.
that again?
Actually, we should bring Lisa in. She's kind of the one coordinating the
Go ahead, she's
volunteers.
still out there.
Yeah, let me see if I can. She has the numbers off the top of her head. Lisa? Lisa? Oh, she did. She went down to get the mail or something.
Okay.
I know that we have been increasing each month so we started in May. We are serving over 100 families each time, and we're still seeing additional new families. I think that they had 39 additional new families last month at the pop-up food pantry. So we're so encouraged by that. It's not just the same people that are coming, and they're coming from all over the county. I think that we serve 300 and some individuals in those 100 and 5 families last month. So also, it's really a great partnership with the volunteers from the community. So we have had partners come from, well, Mr. Leggett was there volunteering couple months ago. And we've had partners from different churches, the Masons. So just having that available for community members to have an opportunity to volunteer. We've on average had about 15 volunteers for each one of the food pantries. And then we're also trying to have our partners come as vendors and exhibitors so that they can get some of their information out to the community as well. So
When is this happening?
it's always the first Wednesday of the month, and it's from noon to 2 p.m.
And it's at the Church of Christ on
Yeah.
the Avenue.
The church up on top of the hill.
And this is a program from the Akron Food Bank that's
Yeah, it's in partnership with the Akron Food Bank.
it's
It's
free to our county.
free to anyone. They don't even necessarily make it just Carroll County. And it's community wide. So one of the things with our, it's not to compete with our food pantries, but a lot of our food pantries have geographical boundaries that they're serving. And so this is an extra meal or supplies that families can get to support and help them get through, because oftentimes they can only go to those food pantries once a month, and the supplies don't often, allow them to get through an entire month. And, with the increase in costs that we're seeing in food and groceries, we just anticipate that this will continue to grow. The other nice thing about it is they usually bring enough for 150 families. So there's typically extra supplies, and they make sure that those go to a local food pantry. So either Loaves and Fishes or Malvern or Minerva are getting those extra supplies as long as they have storage capacity for them.
And would you share with the folks what kind of basic food items are available?
Yeah, it changes every month. So it's things like you can have frozen macaroni and cheese. That would be like Stouffer's macaroni and cheese. There's usually always canned vegetables or canned beans, either baked beans or some kind of like kidney bean or black bean. There's usually some sort of fresh vegetable. I've always seen onions and potatoes. And then sometimes there's even some things that are not food, but like pharmaceutical things. So we've had things like liquid Tylenol or ibuprofen that's been provided that are things that you don't necessarily think about with the food pantry, but they're available as well.
So
Actually had the catfish today. We was there and whole bags of whole stock crops.
Yeah.
And so the mobile pharmacy,
Yeah.
how is that spinning up?
So that is starting out by it will be coming to the health district, the health department on the 1st and 3rd, I think, Wednesdays of the month. And it's kind of the same time that we have our women's health clinic. But it's not just serving that population. Anyone can come to that if they have questions about their medications. And Beacon, the charitable pharmacy, they can provide you with medications at a very reduced rate if you don't have insurance, or if you're on the donut hole is what it's called for Medicare, in which you've already spent your amount, but it's not yet, you still have 2 or 3 months yet before the end of the year. So we're seeing a lot of those seniors now may be eligible for that. So you can get up to 6 different medications for like $6 through the charitable pharmacy. And we also take donations at the health department. So the way the charitable pharmacy works is that they accept donated, unexpired medications through, and only charitable pharmacies are permitted to do that through the state pharmacy board. They cannot accept any narcotics, but anything that is unexpired. So family members that have a death in the family, there's often a lot of medications that are left over. Instead of just taking those to the drug take back boxes, bring those to the health department, and we can get those to the charitable pharmacy, and those can be reused.
So for example, what a blood pressure medication that's not expired.
Correct.
One of those.
Yep, heart medicine, even insulin. They're able to, relabel the insulin if people have that in their homes. So excited about that partnership. We're hoping to be able to get that a little more mobile and out into the communities a little more, depending on their staffing. But we're initially starting with the pharmacists that will be at the health department twice a month.
So I know it's redundant, but can you again provide for the folks out there the dates of the mobile pantry and the mobile pharmacy and where they can link up with it?
Yeah, so go to our website. That's probably the easiest way, at carroll.lhd.org. The food pantry is the first Wednesday of every month from 10 until 2 at the First Church of Christ.
Christ, I'll meet
Yeah. Church of Christ. The other one is the Church of God. It gets me very confused. Up on the hill on Moody Avenue. And the Beacon Pharmacy will be at the Health District on the first and third Wednesdays of each month. And I'm not entirely sure of their hours that they'll be there, if they're there the whole day, which is typically when we see our clients. So, but you can see those on our website, both of those.
Yeah, I think the takeout is there are a host of available services to those that are needy for them, but sometimes they're not able to take and hook up to those. So the last question I have for you is 211. If somebody was to call 211, would these be listed as available to them?
Yes.
Okay.
Yep.
And-
So, good point. But 3 different numbers that we want the community to know the difference. 211 is if you need things or resources. 988 is if you have mental health crisis and you need assistance, to call 988 because it has those individuals that can help you on that line. And then 911 is the traditional emergency number. And the reason we're really trying to emphasize those different is because 911, we've done a really good job of training people to call 911 in the last 20 years, right? I mean, I remember having to memorize the emergency phone number, right, for our fire departments. If we can take off some of that, because if 911 is called, the responders have to go. But it may, 150 of those calls last year were just mental health or suicide related calls that they really don't have the expertise to handle. And if we could have those calls go to 988. Now, sometimes 988 does need to call 911, when they realize that there's a situation that really is an emergency. And I saw that in some of the data that Mr. Hale was able to get us through our dispatch. So really good information that we're not just now compiling that will help serve our suicide fatality review board.
And I like to bring up 211 whenever possible because it's like a one-stop shop
Yeah.
for resources. And I hear so many times when people call in here asking about resources and they don't understand it. You dial 211, state what your need is, and they'll hook you up with the resource that's available.
Yeah, and it's very underutilized in our community. People don't know to call it, so they call the commissioners, the health department, wherever they think that they might get directed to the needs. So appreciate the questions and thank you very much. I need to come and do a health department update every few months, right?
Yep. Lots of good stuff. Thank you
All
for
right,
your
thank
leadership.
you. Bye-bye.
If we've got a clerk's report today.
Yes, along the same lines with the health department here, I do have something that we have shared to from their page. Just to let residents know that they are hosting a women's wellness session at the Minerva YMCA at 687 Linwood Drive in Minerva on September 16th from 10 a.m. to 11 a.m. This event is open to the public and will focus on women's fitness, nutrition, vitamins, and screenings for long-term health. Every attendee receives free 1-month regional YMCA membership. And the other thing I want to share is that the Board of Elections is looking for poll workers for the November general election. You can call the Board of Elections at 330-627-2610. Stop by their office at 119 South Lisbon Street, Suite 102, or visit them online. This information has been shared to the Commissioner's Facebook page along with a link for more information. And that's all I have.
All right, thanks, April. Anybody got any questions for April? Commissioner Work, you got anything for the board today?
Just two things. I'll be attending the Airport Authority Board meeting this evening. And we're going to begin interviews tomorrow on the IT.
All right. Commissioner Madransky, anything for the board today?
Nothing today.
I have nothing for the board today. Anything else to come before this board?
Motion to adjourn.
And I'll second